मेरा नाम बसंत सिंह तोमर है। आज प्लाज्मा डोनेट कर रहा हूँ। एक्चुअली कुछ टाइम पहले मेरे फ्रेंड को प्लाज्मा की ज़रूरत थी। बड़ी मुश्किल में, बड़ा क्रिटिकल केस था, तो यहाँ से मिल गया था मुझे। और अब उस टाइम में कोई पॉजिटिव था, इसलिए मैं प्लाज्मा डोनेट नहीं कर पाया। मैं रिकवर हुआ हूँ और आज मैं यहाँ पे प्लाज्मा डोनेट कर रहा हूँ।
Like Basant Singh, this blood bank gets 15 to 20 odd people a day to donate plasma. This way, it collects about 4 liters of plasma or 20 units daily on average. In the times of COVID, the demand for convalescent plasma far outstrips the supply. Recently, when COVID cases rose, this blood bank got around 500 requests for plasma daily, says the manager here.
There is a chaos because people are not aware. People are just after blood banks. They are just after blood banks that they need a plasma. But the thing is, we are dependent on donors. Blood bank itself is dependent on donors, and donors are those who are recovered from COVID.
But does convalescent plasma therapy, where antibodies from the blood of a patient who's recovered from COVID-19 used to treat serious patients, actually work? Dr Sumit Ray, head of Department of Critical Care at Holy Family Hospital, says the simple answer is no.
None of the randomized controlled trials showed any benefit of convalescent plasma. Among the whole larger population of who were treated with convalescent plasma, there didn't seem to be any benefit. But there is the potential that one small subset, okay, and the selection of that subset is very important. And that is true of all medicine, particularly all critically ill patients. One size does not fit all. And this is not only about COVID, this is about medicine in general. So in that setting, a possible small subset of elderly patients in the first week of their disease who do not produce enough antibodies to the virus may potentially benefit. Okay, so there is this small subgroup.
The ICMR has dropped convalescent plasma therapy from its clinical guidelines for COVID-19. Scientists have warned against the irrational and non-scientific use of the therapy. Is the therapy safe? Are there side effects to it?
Actually, the potential for harm is quite high with plasma, which people don't understand. For three reasons. One is that a large number of patients have a worsening of the disease in the second week when the virus is gone from the body. And that happens because of what is called a dysregulated immune response, also called a cytokine storm. What is a cytokine storm and a dysregulated immune response is that there is an overactivity of the immune response sometimes. And in a patient who already has an overactivity of the immune response, if you are giving more plasma to enhance the immune response, it can cause worsening. People don't realize that. Second is, COVID also causes clotting in the blood vessels, particularly the smaller blood vessels in the which supply the lung and other parts of the body. And plasma in general increases the clotting in the blood. Third is that any blood product transfusion, and particularly plasma transfusion, can cause its direct damage to the lung. Not for everybody. It's again, as I said, different subsets can cause direct damage to the lung. It's called TRALI, transfusion-related acute lung injury. So all these are the side effects which are potentially there for plasma. So the benefits are absolutely questionable. For most people, it does not benefit. Large trials have shown no benefit.
Should people donate plasma?
There is no strong evidence to suggest that plasma benefits. Okay, this whole idea that let us do something is not scientific. I mean, there are two things. One, it's both propounded or propagated by both doctors and sometimes close loved ones of the patient who's admitted, that if nothing is working or the patient is not getting better, let us do something. Doing something is not scientific medicine. One has to do something based on evidence, based on that particular patient's needs, right? So running around like maniacally trying to find plasma and doctors prescribing without looking into the evidence and the possible small subset who may benefit is counterproductive.